Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. I'd like to welcome the Medicine Forward host team for our upcoming transformational gathering at the New York City Burnout Symposium coming up in November 2024. Thanks for joining us today, my friends.
So glad to
Nice to
be
hear
here,
you.
Kim.
I'm glad to have you all. And by way of introduction, you've all been here on my YouTube channel before, so I'll have each of you briefly introduce yourselves in a moment. We have with us today Denise Wiseman, and we have doctors Dawn Ellison, Jeff Cohn, and Gabe Charbonneau. Okay. And today we'll be talking about what is medicine forward and what is open space technology as topics with general appeal, and also why you'll be excited to join us for our transformational gathering in New York City. So, as I always ask when we get started, what would you most like our audience to know about you? And we'll go around on the screen. So, we'll start with Jeff.
Hi. So I'm a physician coach, a retired oncologist, and I'm a very proud father, grandfather, and diehard Philadelphia sports fan.
Okay, and I think that's all anyone would need to know. Don, how about yourself?
Sure. So I'm a retired emergency medicine physician, and I am also a physician coach and consultant. I've had my company Influencing Healthcare since 2008 and been working in that space for a long time. And one of the things I got to learn about was open space technology. So I'll share that with you in a little bit.
Okay, fantastic. And Gabe?
I'm Gabe, and I'm a family practice doctor in rural Montana. The thing to know most about me is that I am deeply passionate about making healthcare more human, and that comes from the people that I care about in my life, and especially worrying about future generations like our kids and grandkids.
Yeah, absolutely. I love that. And Denise?
Hi there. I guess I'll start with I'm a self-described healthcare ruckus maker and really working to connect others who feel a passion for the healthcare that we could and should have. And that's how I'm connected with this group, these individuals, and really looking forward to the events ahead of us, starting with the event on November 20th.
Okay, great. All of that is fantastic. And as we get started, Gabe, would you like to share a bit about Medicine Forward, maybe the history and what is Medicine Forward? That we're
Yeah,
all part of the traction team.
yes, which is awesome. This is actually so exciting to have this group together here, and that we're going to be together in New York. It just gives me lots of joy to think about that. And so, just a little bit of history, and actually, maybe before I jump into that, Denise had asked us to think about maybe a takeaway from today that we really want people to consider. So, I'd like to start with mine. Because this came to me this morning as I was sort of recapping my adventures to get to this point in life. And the takeaway for me is that you really never know what experiences are going to lead to transformational connections.
Mm, mm,
Yep. I was looking back in my own story and thinking about all these little dots along the way, and the way that I'm connected with you all happened because of things that I never would have expected to happen. So with that, Medicine Forward is a 501c3 grassroots nonprofit. We started in 2019, and it began through a friendship connection between me and Dr. Eric Topol. I actually gave him one of these shirts, the Fight Burnout shirt, and during our conversation, he said, "Gabe, I really love what you're doing, and think that there's potential for us to consider." Something that might be a little bit bigger social movement. And essentially, he was alluding to a piece in the New Yorker that he was working on that basically said doctors needed to find new ways to get together to stand up for a more human future for medicine. And so when that piece came out, he sent it to me, and I read it and was excited. And that sparked the two of us basically starting this organization, and we brought in others. And then through the last going on 5 years now, we've just tried a lot of experiments to see how we can make an impact. We started out as mostly a doctor's organization, and the core foundation was advocating for the doctor-patient relationship. And we have realized that if you're standing up for and fighting for that relationship, it's important to bring in people besides only doctors. There's two sides to that relationship. So we're excited to actually be expanding in being a more inclusive organization and having all kinds of people who care about the patient-physician relationship. Two more things I'll share very quickly before passing the mic. One is our bold 10-year vision, which is to activate 10 million people to be doing something to help the patient-physician relationship. And our mission at Medicine Forward is to move medicine forward to a place where patient and physician relationships can flourish. So those are the things that are our compass. We've worked hard on thinking through those together, especially at our retreat about 3 months ago, and really looking forward to living those more as we do more together, and including our activities in New York.
That was a great summary. Thank you for sharing, Gabe. And we've all been together, the 9 of us, since about last summer, generally speaking, around last summer. So I thought I'd also give a shout out to the members of our traction team who are not with us today. And that would be Dr. Todd Otten, Dr. Marianne Welber, Lisa Scardina, and Eva Minkoff. So a shout out to our colleagues in this episode here. And Dawn, would you like to share a little bit about the origin of open space technology, as you're our resident expert on the topic?
Yeah, sure. So I joined Medicine Forward about a year ago. And when I heard that folks wanted to have some kind of a big gathering, kind of a national gathering, I immediately thought about open space technology. And the origin story of open space is pretty relatable. Harrison Owen was a conference designer. You know, he put together conferences. And what he noticed over and over again was that in the typical conference that he was organizing, the energy was really around the coffee breaks.
Mm-hmm.
And I think we can all relate to that, you know, going to conferences and getting into the coffee breaks, and just the volume goes up, right? Because people are really excited about talking to other people in the conference about the topics that they're interested in talking about. And, you know, generally there's a lot of expertise in the audience, right? And so what I thought would work really well is to do an open space for Medicine Forward, where we can bring people together and really talk about the issue that is just so important to Medicine Forward, as well as Cohn National Network, who is a sponsor for us at this conference, and which is about human connection and flourishing. And so open space allows people to come together and then create the agenda, create the topics that they want to talk about. So I'll just stop there.
Okay, well, it's super exciting, and I'm very happy to be involved. Denise, is there anything you would like to share?
You know, what I actually want to share is I want to connect two things that have been said. So, Gabe, I love that you started by saying that you never know the experiences that are going to lead to connections. And that piggybacks so well with why we've selected open space for this workshop. The right people will be there. They will introduce the right conversations to be having. The right people will join those that are called those conversations that are brought to what we call the marketplace. And we cannot anticipate today what will happen because of that. What exactly is going to be the center of conversation in those, what each individual is going to contribute, and more importantly, the connections that we're going to make, and then where those are going to go. And I just love thinking about what might happen there. Many of us may not know each other in the room, but months from now, we might be engaged in doing something really meaningful because of what happened in that room.
Yeah.
I love that. Would you like to share a little bit how HRC did something along those lines that I was involved with?
Yeah, definitely. And actually, I would say HRC is really exactly that. Our purpose is to identify those individuals, such as those on the call here, and so many hundreds of others that I've met and we each have in our own networks who are purposely trying to do something to better healthcare and to help to convene them and connect them and enable them to find others that can help them to ideate, design, and then test of change. The workshop you're talking about from a few months ago, that was a listening event that HRC did where we were purposely seeking to listen to those who we want to serve. But it's just an example of the workshops that we will continue to have. Our next one is December 16th. And we are again trying to convene individuals from a variety of different roles and experiences. The diversity is what makes it rich. But we can do this in a virtual nature where we can actually come together and through the technologies that we've all learned to adopt, especially the last few years. I feel like I'm in the room with all of you right now. We can do the same in these really highly engaging opportunities to come together to ideate and to carry that forward into other formats.
Well, thank you. And I think we're also oh, sorry, Gabe. I'll just say one thing and then you could go ahead. That we're very fortunate that Denise and Dawn are intimately involved with Medicine Forward and HRC. So that itself is an excellent example of connection and collaboration. Go ahead, Gabe.
Yeah, I just wanted to share really briefly. So I've never been a facilitator of open space, but I've been a participant, and it actually was part of what made me think about that idea of not knowing what experience would lead to these connections. So I was part of a hackathon in Missoula, Montana that was hosted by MIT through their hacking medicine program. And at the time we were starting a software startup, we were trying to make macros to make Epic easier for doctors. And we really had just started venturing out of the space of being practicing physicians and could use any sort of ideas and support. And it certainly seemed like MIT would be interesting. Well, anyway, they used open spaces. I didn't know anything about what it was. There was a man who'd facilitated before, and he brought us in and introduced us and sort of said, okay, here we go. Like, here's the general organizing topic. And if you have an idea, go and write it on the wall and share it and see if other people vote with their feet that they're also interested in this. And it was a little different for not having done that before, but I have to say, like, participating in that led to so many just little things that were a butterfly effect for me. So we ended up pitching in that event. I met lots of connections through that. One of them was a woman who introduced me to a friend who founded this startup I'm really interested in called Orchid Health in Montana, you guys know about. It also led to just many other network connections through MIT and otherwise. And so participating in the open space was just a part of it. And I think it sort of unlocked this like, oh, you can go where your interests are and find out where other people might share some of those interests, and you can share ideas about how you might do something and get creative together. It was just such a positive experience. And this is actually 10 years later from when that happened. And as I'm kind of recapping those things, I just want to encourage anyone who hasn't done an open space event to really consider this as a neat opportunity.
Mm. Well, thanks, Gabe. So, Jeff, now we're going to go to you, and I intentionally had you go last because as we've discussed, you think a little bit differently in a great way. So, I wanted you to hear what everyone else said first, so you could add your wisdom.
Thanks. Well, first, if anyone noticed, I smiled briefly when Gabe had a very understandable slip as the guy from Montana when you briefly called it open spaces instead of open space.
I told you I'm not an expert.
The big sky guy in you. Well, one thing that is going through my mind is that, that for some, the idea of a burnout symposium might seem kind of heavy and maybe not a particularly pleasurable thing for people to convene around. And in the coaching framework that I utilize, that I know Dawn has been an advocate of as well, there's this perspective that every challenge, like the conditions leading to burnout, can be turned into a gift and opportunity. So I think you're hearing Gabe and Denise, all of us, talk about how people coming together because physicians and other healthcare professionals are burning out, and oftentimes with very serious consequences, still that can provide the container and environment where surprising things can emerge that lead to massive upheaval of the forces that are leading to burnout, and solutions that no one might have dreamed of in advance. That's also one of the things that I love best about the format that we'll be using, open space. Many conferences bring experts sharing evidence and other expertise that has already been developed. And there's a great reason for utilizing that for certain problems in the world. And when the National Academies of Medicine wrote about burnout and physician well-being a number of years ago, they acknowledged that much of what needs to be done to change things probably hasn't been figured out yet, and that it may be context specific, that what will work for this group of practitioners in this environment may not work in the next state, or even the next town, because it's partially based on history and relationships and culture and stuff like that. So open space creates the perfect environment for figuring stuff out and ideating and innovating, and then taking something back to keep the conversation going and try things out at home. So I'm really excited for lots of things that can emerge from our session.
Well, thanks, Jeff. That was beautifully said. So, Dawn, I'm wondering if you can speak too, because I'm wondering if some people are shy or introverted and they're listening and they're like, well, I don't really quite understand what this is, what would be expected. Because when you go to a conference, you sit there and take notes, right? Or if it's a practical, that you're going to be, manipulating knees or something like that. So, something like this, I don't know if there might be an apprehension about the unknown. So can you speak to that a little bit?
Sure, that's understandable. I'm an introvert myself, so I get that. There's different roles for people who show up to an open space. And one of the roles is to be a caller, to say, hey, I'd really like to talk about this subject and I'll be over there, right? And to invite other people in. And then there's those people who decide, you know what, I like what that guy's going to go talk about, and I just want to participate with that. And then there's bumblebees, which Kim is going to be an outstanding bumblebee for us, because bumblebees go from space to space and they listen for snippets of what people are saying, and they cross-pollinate. So if they hear something really interesting over here that this group could benefit from, they bring that over to the next group. And then there's butterflies. So a butterfly might be someone who is perhaps courageous enough to call a space, but is ahead of their time, and nobody else is really interested in that subject yet, right? And so they can just go sit in the corner and be a beautiful butterfly, and get to take that time to think about that subject that they are passionate about even if nobody else is. So there's different roles, and everybody can find a place that's going to be comfortable with them. And, one of the law of mobility is that if you find yourself in a space where you feel like you're not able to contribute or you're not learning, it's okay. It's actually expected that you go to another space where you can contribute, where you can learn.
Mhm.
So nobody should be frightened of it.
Yeah, well, thank you. I think that was a beautiful explanation. So if you come and show up, you'll find out what it's about, and everyone will find a comfortable space for them. So thank you. So the actual four hosts that would be involved is Jeff, Dawn, Denise, and myself. And Gabe will actually be presenting at the Burnout Symposium. Did you want to speak a bit to that, Gabe?
Oh, sure. Well, I'm a supportive role. And so as far as my role in the open space, is just to be a helper and a participant. And so I am also an introvert. People don't always get that, but my nature is introverted. And I had ideas, but wasn't feeling courageous to do something or pitch an idea. But actually, it was someone from the MIT team came up to me and struck up a conversation and gave me a pep talk to do it. And so I just want to put it out there that one, you don't necessarily have to be the most outspoken person to get something out there. People want to help. This will be my third time going to a burnout symposium. It's a wonderful group of people that it attracts that really genuinely want to make a difference in healthcare to make it more human. That's been my experience every time. And as far as my role, I will be doing a short presentation on the stage at the main stage of the conference to talk about any takeaways from the open space. So it's a chance to share with people who might not have gone to the workshop, or even those of us who have, to sort of see some of the output that we come up with.
Well, that's terrific. So, as everyone knows, it's going to be speaking to restoring and nurturing the human connection in healthcare. So I thought I'd just speak a bit to that myself and why it's so important to me. And of course, I'm excited to be part of both Medicine Forward and this upcoming event. And speaking professionally as a physical therapist, healthy relationships were always at the center of my work with my colleagues, whether I was a staff therapist or acting head of the department, and with my patients. And I worked hard to build and maintain positive relationships so my colleagues and patients would feel seen, heard, and understood. And with the introduction of the EMR, all of that changed overnight. And I'll just give two quick examples for our audience because you have all have lived it. But like eating lunch, we used to PTOT speech, sit together and talk about our weekends, talk about our families, talk about our patients, like Mr. Jones going home Friday and I haven't done a set of real stairs. Could you spot me tomorrow? Like things like that. And then I ended up like eating lunch, by myself and bringing things that I could eat with one hand and, type with the other hand, like literally. And then also the camaraderie in the gym. When you were in that gym, the PTs, OTs, patients, it's like we were a little family or a little unit. And, there was bantering amongst all of us. It might not be your patient or your therapist, but we would just laugh and joke around. And once we had those computers, like there's so many clicks, as you all know, that you did have to spend so much time on the computer. It didn't totally get rid of that, but it really reduced it quite drastically, I would say. And then speaking personally, as a patient, having had several cancers and multiple surgeries over the past few years and facing a fifth surgery soon, I've seen 40 doctors and I've had all kinds of experiences from wonderful to having a lot that would be desired. And I love the doctors I have now, and I started doing this work to try to find ways to support them. And I give them so much credit for managing to nurture that human connection, even amidst all the obstacles they face. And sometimes I do worry, what cost to them, because some of them I know are doing their notes or responding like 11:40 at night, to messages. And humans are wired for connection, and nurturing the clinician-patient relationship is vital. It connects the clinician to their why, why they decided to practice medicine. And it goes a long way towards healing the patient. And I feel like I'm a poster child for that. And I could share so many examples from my experiences over the past few years, from everything I've learned from working with my physician coach, Dr. Michael Hirsch, to the doctors and patients working together on our Medicine Forward team. We're an example of it too, right? We're doctors and patients on our team. And I'm just going to conclude for myself by sharing the title of one of my collaborative Kevin MD articles that's incredibly special to me. And Dr. Tony Avellino suggested this title for the article he and I wrote together. And it was A Patient Reached Out to a Doctor and They Helped Each Other Heal.
That's beautiful.
I think that
Nice.
kind of says it all, right? What it's about. So we'll go around in closing, whatever you all want to say. And also, actually, before we do that, how can listeners sign up for this event that's on November 20th, 2024?
The ICD website. So if you Google search ICD Burnout Symposium New York City, it'll come right up. I'm sorry, I don't have the URL off the top of my head, but you'll find it there. So register for the event and do an add-on workshop for this event with Medicine Forward. It is the morning gathering.
And I'll put the link, of course, in the show notes and when I share it on LinkedIn.
And
Perfect.
use MF20 to get a discount.
Yes, okay, absolutely. So what we're going to do is we're going to go around one more time, and any closing remarks you each had, and also how can people reach out to you for more information. Jeff, would you like to go first this time?
Sure. So New York City in November will be an exciting place to be. And I can't think of a better way of spending a morning than with the folks on the screen today and with the people that are going to show up talking about an issue that all of us who are connected to healthcare, either by providing healthcare or receiving healthcare, care deeply about. We need people's input. You're going to make a difference by being there. So I look forward to seeing some of the listeners at the event on the 20th.
And how can we reach you?
Reach me. My website is care to change coaching. That's all one word, .com, and 2 is the word TO.
Great. And I will put all these links also in the show notes. Dawn, any of your closing remarks, and how can we reach you?
Sure. I'm really excited to see everybody. I hope you all show up on the 20th. We've been planning this for many, many months, and it is the right thing for the right people. And again, looking really forward to it. A phrase that I really like is, we can be better together and we can be together better. And you can reach me. My website is Dawn M. Ellison with an E.com, MD.com, Dawn M. Ellison MD.com. And yeah, hope to see you there.
Sounds good. Gabe?
Yeah, I think the main thing I want to just express is so much gratitude to this group for putting this together. It's been a magical experience the other 2 times I've been to the Burnout Symposium, and I'm the most excited about this one, both because of the energy and work of this group and the potential for bringing others in. I think it's going to be really special. As far as finding me, I'm gonna put a shameless plug for Medicine Forward. You can find me through medicineforward.org. And if you join us on our Mighty Network, that's a great way to find me.
Fantastic. And I'll share that link too. Okay. Denise, bring it on home.
Excellent. Well, I have 3 things to offer. One, I want to identify that when you talk about open space, one of the 4, are they rules, Dawn? I don't remember what they're called, but one of the 4 is that the conversation ends when it ends, which means our time might end in the workshop, but we're together in New York for an additional few days. That conversation could continue and really should. If it's something that you're passionate about, Convene with those who are in the workshop with you or with others. Bring others into the conversation, expand it further. The other piece is I just really want to do a shout out for K&N, who is sponsoring us. Their mission and vision aligns with Medicine Forward. So Medicine Forward uses the word flourish. K&N is all about flourishing. This is the right event to come to what I really appreciate is somebody identified to me that I think this is the 7th annual Burnout Symposium event. And she said, 7, we need to start moving from talking about burnout to finding solutions to burnout. This workshop, the work that K&N is working on, the work that Medicine Forward, this is to find solutions and to carry those together forward. And then the last thing, I'm going to, similar to what Jeff said, it's New York City. My mother-in-law and my husband are going with me. I am taking them to the Rockettes Christmas show because I saw it 20 years ago and it is fabulous. Make it a holiday. Come to this event and really engage with others and then engage with others outside and enjoy the beauty of New York City around the holidays.
Very well said. And how can our listeners get in touch with you?
Thank you for that reminder. You can find me, email me directly at denise@healthcarereinvention.com or find me on LinkedIn. I am out there. You'll easily, if there's other Denise Wisemans, you'll find the one that it says Ruckus Maker in the tagline. You've got it. Reach out to me there.
Okay, fantastic. Well, thank you again so much for being my guest. This was excellent to have you all on together and lots of fun and educational, I think, as well. So I'm going to close the way I close every episode. And I say to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.
Thank you, Kim.
Thanks, Kim. Bye, guys.
Okay, bye. You're very welcome.